Well, Sydney's coronavirus outbreak has led to some genomic sequencing that showed the cluster comes from an international strain. Premier Gladys Berejiklian confirmed this today. Have a listen.
No, we can't confirm that. What we can confirm, however, is that the original source is an international strain, and how they got into the community is what our genomic tracers are working out as we speak. But what is the absolute priority for our health experts today is to contact everybody with the disease, obviously, but also get in touch with their direct contact.
Well, for more on this, I'm joined by the Chair of Epidemiology of Deakin University, Professor Cory Bernardi from Melbourne. Professor, thank you for your time. I understand that contract tracers are yet to work out how it got from the international source into the community. Is that correct, and is that a cause for major concern?
That's right. We haven't heard yet. That's something they're still investigating. There is one returned traveller that has a strain of the virus from their own testing that is similar to the one that we're seeing in the community. So that's certainly given the Health Department a focus to see whether or not that case might be linked. And if so, that could help them identify where there might have been some sort of opportunity for that virus to be transmitted and to escape into the community. They also don't know who the person was who was positive, the first person who took the virus into these Avalon clubs that caused the subsequent spread. So it might be one of the cases we know about. They just didn't know they were infectious and it's hard to tell them apart. But it might be someone who's not visible to the Health Department yet. And that makes it also very hard to look upstream to try and figure out the source of the case. It's important we do it. We have to both understand that to make sure there aren't other cases out there that we don't yet know about, other chains of transmission. But of course, it's also really important so we understand if there has been a failure at the border, how that happens, so that again we can try and look at improving our systems yet again, just to make sure that we're not at risk of that happening any more times.
Yeah, Professor, what makes an international strain different to, say, a local strain? And does it require a different treatment process, or does it establish different symptoms? How concerned should we be that it's just not what we're used to?
They call them different strains. They're really just different variants of often very closely related types of viral strains. So these might only have subtle differences in the genome, but they're differences we can pick up when we do the testing, and it allows us to identify a variant that is different to the ones that are circulating. So it's helpful because we knew the cases that we had in Victoria, for example, that were linked to that quarantine breach. We had 2 different quarantine breaches in Victoria, but you could then trace and see which cases were related back to those initial introductions. And in that case, it was the second wave. Same here. They're finding all the cases are not only related, sharing a strain, but they also can use that to try and trace back and see who might have come into the country testing positive for that same strain or something very close to it. So you get all these subtle changes in the genome, most of them inconsequential. They don't change how the virus spreads. They don't change the type of disease it causes or how severe that is. They're just little fingerprints, if you like, that allow us to say, all right, that's a bit different. That's the one that's evolved to be slightly different in its genome in the US. And then we can tell when it turns up in Australia that it's not one we've seen here before, therefore it must be imported. So remember, we haven't had many strains in Australia. Since June, it's really been those 2 strains that were brought in on the contact breach, if you like, of the contacts of those initial travellers. And again, in South Australia, and you've had 2 recent ones in New South Wales. So we don't have a lot of different strains circulating. But yeah, they don't really make a difference in terms of risk of spread. And most importantly, they don't cause a different or a more severe disease, which is really important.
Professor, what about with the vaccine trials that are going on, or now they're being rolled out internationally? Are these vaccines tailor-made to target particular strains of the virus, like, say, a flu vaccine will, or a flu shot that people receive every year? And so are we right to then require a number of different vaccines, or will one vaccine probably sort out everyone in Australia?
That's a good question, Cory. The good thing is, because these changes are so subtle, they're not going to impact the very specific component of the coronavirus, which is this protein spike that sits on the virus. That's what helps it infect humans and causes so much trouble. That's consistent across all these variants. So the vaccine will still work. The variants aren't different enough to evade the vaccine, to be, so different that the vaccine hasn't stimulated the right immune response in us to that particular strain. At the moment, the vaccines cover all strains as far as we know. So we don't want to see the virus to keep evolving and to change and to risk our vaccine efficacy. And so that is something that they've been watching for. But to date, none of the changes have come anywhere close to actually impacting on that very specific aspect of this virus that they're all targeting, which is this protein spike, which is good news.
It is good news and very reassuring, I'm sure, for many of our viewers. Professor, thank you so much for your time, and may I wish you a Merry Christmas, as I'm doing to all my guests tonight, and stay safe over the break.
Thanks. Same to you, Cory.